Today we're going to discuss the contrast and comparison of two medications. Those two medications are acetaminophen and oxycodone.
Therapeutic use for acetaminophen is analgesic for mild to moderate pain and fever reduction. The adverse drug reaction is liver damage that causes overdose and hypertension.
So for interventions, monitor for early manifestations of overdose poisoning, abdominal discomfort, nausea, vomiting, sweating, diarrhea. Liver damage results into 48 to 72 hours following an overdose. You want to prepare to administer the oral medication or IV contrast for overdose to reduce the liver injury. And you also want to monitor for blood pressure. For administration for acetaminophen, you can administer acetaminophen orally or rectally. You want to caution your clients that the medication is available in many combinations, products, as well as many formulations. Clients must read the labels carefully to avoid overdose. Do not administer more than 4 grams a day for adults, and for infants and children, it should be given by the manufacturer's recommended dose based on their age. As I mentioned before, for the acetaminophen client instructions, you want to report any abnormal discomfort, nausea, vomiting, sweating, or diarrhea immediately to your primary care physician. And you also want to have your blood pressure checked regularly, on a regular basis. Acetaminophen has contraindications, and one of those contraindications is alcohol use disorder. Avoid alcohol at all costs while taking acetaminophen. Also, we have precautions. So you want to tell your clients to be cautious of if they have anemia, immunosuppressants, hepatic or kidney disease. And as far as the interactions concerned, acetaminophen, alcohol increases the risk for liver injuries. Also, warfarin increases the risk for bleeding. So now we're going to discuss oxycodone. The therapeutic use, the adverse drug reactions, the interventions, the administrations, the client instructions, the contraindications, the precautions, and our interactions for oxycodone. Oxycodone therapeutic use is for moderate and severe pain. This medicine is an opioid for a pain reliever. The brand name is also known as Percocets. Adverse drug reactions on when to not use this medication if you are having any respiratory depressions, stomach issues, bowel blockaging, any asthma, any breathing problems, or any lung issues. You should avoid this medication. An opioid medication of oxycodone comes in different forms of capsules, liquids, tablets, and long-acting tablets. You want to take your medication as prescribed by your provider. And if you need to change your dose, you want to make sure that you contact your provider. So, client instructions. There are drugs and foods to avoid while taking oxycodone medication. So you want to ask your provider or pharmacy before using any other medication, including over-the-counter medication, vitamins, or any herbal products. You do not want to take this medication if you are having any MAO inhibitors within the past 14 days. And some indications can affect the outcome of the medication. Tell your doctor if you are using any of the following, and I'll put a list here of some of the other medications. You want to tell your doctor if you are experiencing anything else that makes you sleepy. Some examples of allergy medicines, narcotics, pain medicine, and alcohol. Tell your provider about medication precautions and warning signs while taking oxycodone. So you want to tell your provider if you are pregnant, if you are breastfeeding, if you have any kidney disease, lung disease, liver disease, or anything going on in your system. And then this medicine may cause any of the following problems. It's a high-risk medication, so you can easily overdose and it can lead to death. So you want to make sure that you are not experiencing any respiratory depressions, sleep-related breathing problems, worsening of pain, liver problems, any adrenaline gland problems, low blood pressure issues, any of those signs and symptoms and manifestations. You want to report them to call your provider immediately. 911, that's an emergency. Some other possible side effects while using this medication, you want to call your doctor right away if you notice any of the side effects or symptoms. Allergic reaction of itching or hives or swelling of the face and the hands, any tingling in your mouth area. You want to notify the provider immediately if it's any issues with your throat, chest tightness, trouble breathing, if you're experiencing anxiety, if you have any blistering or peeling or red rash, your blue lips, fingernails or skin, changes in the skin color, dark fragiles, cold feeling or tightness, confusion, trouble breathing, dark urine or pale stool, lightheadedness, dizziness, and worsening of the pain. You want to notify your provider immediately. You also may notice some of the less serious side effects where it's like a headache, constipation, or sleepiness. If you notice any of those side effects, that are